Chronic pain in cats does pose a bit of a dilemma because cats respond differently to drugs than do dogs, and there are very few FDA approved chronic pain meds for cats. So what are we using? Well, if we're going to use drugs and medication, there's one called robenacoxib or Onsior, which is an approved drug for cats. It is being used now long term, has been used in Canada and in Europe, and is now available in the US. The non-steroidal anti-inflammatory meloxicam does have a black box label on it from the FDA, but at a very low dose, 0.02 milligrams per kilogram, it has been used for chronic pain long-term in Canada, and it certainly is one that you could use off-label, but you would need to have your client's approval to use that. As far as opiates go, buprenorphine is the mainstay that we use for cats. There is a new long-acting buprenorphine which you can use as a subcutaneous injections for cats, and that is something that's coming out. The new molecule grapaprant is going to be available and at some point will be labeled for cats as well, and that one is supposed to revolutionize the treatment of pain in cats. So other than that, what are we using? We're using more local anesthetics with cats, and then we're using other alternatives. I use a lot of acupuncture in cats. We use physical therapy modalities, massage. We'll use some chiropractic spinal manipulation therapies for cats that have those kinds of issues. We will also use even things like underwater treadmill. We'll use laser a lot in cats. And then there's a few other molecules people don't think about using for pain in cats, and one is amitriptyline, often used for cats who have bladder problems, but very, very good for chronic pain at low doses. So those are the areas that I would go to with kitties.